My name is Gayana Yanukian. I also go by Gayana. I'm a senior scientist in the department, and I also lead the Johns Hopkins Biostatistics Center. The center is a practice and consulting arm of the department since 1997.
So my name is Jiangxia Wang. I'm associate scientist and associate director of Johns Hopkins Biostatistics Center.
My name is Josh Betts. I'm an associate scientist here at the Johns Hopkins Biostatistics Center.
So as part of the general ICTR umbrella, which again, it's a grant to the Johns Hopkins as an institution, there are different cores that support research, right? Different stages of research. So we're part of what's called Biostatistics, Epidemiology, and Research Design, or BIRD core. And these BIRD cores actually exist in different universities or institutions. And so within the BIRD core, there is a biostatistics and study design program that, again, that's a service to our faculty that do clinical and translational research. And so within that program, Biostatistics Center is the key part.
So for the ICTR Free Working Clinic, that's a biostat support resources for Johns Hopkins researchers. So any faculty or research staff, they can sign up and have and talk to us about their research questions. So it's a 1 hour free clinic on the first come, first serve basis, so they can bring any questions they may have about biostatistics. Those researchers actually come from all departments from Johns Hopkins, mostly from School of Medicine and also from the School of Public Health.
So the ICTR program helps people connect to a biostatistician that helps triage their request. Something, it may be, I have a simple question about how to do something in a particular statistical software, or it could be something more complicated, like I am trying to determine what's the most appropriate statistical approach and how much time it might take and how much support that might need. Or they may be somebody who is interested in going after a particular grant funding opportunity, and they need to kind of understand, what are the statistical things and data collection aspects that they need to focus on in their grant to maximize their chance of success. So for ICTR with grant preparation, we have up to 10 hours to kind of help people, sharpen their aims, making sure that we have a question that can be readily translated into, what data do we need to collect? How do we need to analyze that? What are the considerations we need to think through there? And then also make sure that we have, for their scientific aims, make sure that they have the resources needed to carry that out. So doing what people often call power or sample size calculations, which is basically determining, how many people do you need to interview, or how many participants do you need in a randomized trial in order to get a scientifically meaningful, to detect a scientifically meaningful effect, if one exists. So it's not just, helping people with high-level questions, it's also getting down into, determining what sort of budget you'd need to address that question, and then also preparing them with a statistical analysis proposal that basically shows they've done their due diligence, they've thought through the thorny questions, and they actually have an actionable plan right from the outset.
Another advantage we have is we have access to world-class experts in biostatistics, and we have close contact with our faculty who develop methods in different areas. For example, if we have any question about clinical trials, adaptive clinical trial design, we can reach out to Michael Rosenblum. And if we have question about survival analysis, then we can reach out to Mei Chen.
So ICTR kind of gives people that little bit of support and connection to a biostatistician that otherwise, may not happen because again, if you're a basic scientist, you don't really bump into all that many statisticians, in your day-to-day work. So it's important to have like the ICTR because it helps people connect to the expertise they need to do their job more effectively, go after grants, and then spend those grant dollars most effectively in terms of making the most out of their experiments and studies.